Today we're standing outside the very first offices that ACT occupied when it first became a community organization in 1983. We were upstairs in this building, and downstairs was the Kentucky Fried Chicken. So the early days of ACT was really about trying to respond to an epidemic that very few people knew very much about. There were no treatments. But what we wanted to do was gather as much information as we could, get images out into the community to reach gay men that were explicit, that told them the information, that told them the facts. One of the key messages was the No/No campaign. And that really was a reaction to the 1980s Just Say No, which was going on in the States. And what we were saying is, no, you don't have to not have sex. You can have sex. Just know what the risks are and know what you can do to protect yourself. Eventually, we did get funding, including city funding, but a lot of our images that we used were seen as being controversial. One example is the early BDSM campaign that we had produced. What was interesting is we actually didn't use city money to produce that campaign, but a city councillor brought the brochure to city council, waved it in front and said, "How dare we be funding this filth?" And we've faced that many times over our years of work, including today. Probably one of the biggest campaigns that we've ever done was the Welcome to Condom Country campaign, which came out in 2001. We've been doing messages in the community for years, but we really felt that we needed to reach gay men broadly. So that included billboards, posters, subway ads, transit shelter ads. And what was really cool about the campaign was this idea of turning on its head, if you will, the hyper-masculine identity of the Marlboro man. A number of years ago, we had a huge spike in syphilis infections amongst gay men in Toronto. So one of the things that we did was we actually created a campaign, a series of campaigns, but the biggest of which was called The Attack of the Cursed Syphilis. And if you look at it, it was actually a bit of a humorous take on a 1950s poster of the creature from the Black Lagoon. The campaign was important because if you're living with HIV, having a sexually transmitted infection makes it more likely for you to pass on HIV, and syphilis can make you a lot sicker if you have HIV. I think one of the biggest challenges facing ACT, facing the community as it relates to HIV, is a perception that with advances in HIV treatment, which have really prolonged the lives of people living with HIV, that HIV isn't as major a health concern as it really is. And I wonder sometimes whether particularly gay, bi, and other queer men recognize that we're still the majority, the overwhelming majority of new HIV infections. And although there are treatments aren't a cure, and there's still a lot of stigma and discrimination facing people living with HIV.